Hi, good day, everyone. My name is Oluwafunmilayo Aregbesola, and I'm going to be your moderator for today. Thank you for joining us. Today, we are celebrating our World Physiotherapy Day. Good morning, everyone. My name is Oluwafunmilayo Aregbesola. I'm going to be your moderator for today. Fatai. Thank you very much. Thank you, sir, for making this possible for us. I remember in the house, Deputy HOD, in person of Mrs. Adebite Aturu. Can you please give a resounding round of applause? Thank you very much, ma. Thank you. Also, I'd like to acknowledge the presence of our director, our assistant director, physiotherapist, chief physiotherapist, senior physiotherapist, physiotherapist. You can see that we have so many titles in our profession. Intern physiotherapist, student, and most importantly, our seniors among us and the friends of department. So I want me to mention the name of these people. In person of Mr. Kamaldin Junaid. Sir, where are you? Is he here yet? Okay. Pastor Agbegbe Rufus. Thank you, sir, for joining us here. Mr. Adeoti Dr. Olatunji, is he here among us yet? Okay, please let's start for him. It's not easy now. We called them and they responded. We really appreciate you guys for coming and joining to celebrate our day with us. Okay, now I also want to acknowledge the presence of the speaker. Okay, one of the very important speaker here today, in person of Dr. Oludaisi Oduni. Welcome, sir. Thank you so much for joining us. And also our in-house speaker, Mrs. Oluwatoyin O. Thank you for joining us. Thank you, everybody. Oh, Miss, sorry. Thank you, sir, for correcting me. So we are going to dive right into the business of the day. We don't want to take much of our time. We want to learn. We want to empower our seniors. We also need to empower ourselves as well because we are also going to age someday. It requires tools to walk along our path. Okay, so firstly, I'm going to call our speaker. We're going to shed more light on the topic we have today, that is early aging, with focus on prevention. And she's going to shed light on this topic from the physiotherapy perspective. So I'm going to be calling on Miss Oluwatoyin Fanimoku. All right, thank you. So you have the floor.
Good morning, House. Good morning, HOD, friends of the department, my fellow colleagues. I'm Fanny Oluwatoyin, and I will be taking us through the talk today on healthy aging, frailty, and prevention of falls in the elderly population. So I'm sure you are very familiar with the concept of falls. It's very simple. Basically, people falling down, and this is something that affects the older people in our environment a lot. Most of us know one elderly person or the other that has fallen in recent times, and might not see it as a big deal, but it's a serious problem to them. We have not started the film.
Well, sorry about the mix-up, and I feel the doctor should present first, followed by the physiotherapy presentation, so that we can have all the questions together. I think that is how it should be done. So that should be corrected. Thank you. Well, there is no welcome address for me. I was asking for your.
Oh, sorry, sir.
I don't know. No welcome address for me, but I would like to welcome our doctor, Dr. Oduni, for honoring our invitation. Thank you, sir. You're welcome. He's the Okwaruko in last week.
Yeah.
We are boyfriends of Aruko. He's the Okwaruko. So thank you very much for honoring our invitation. Please have your seat there. It's going to do the first presentation. And our elderly, the invited guests, thank you for honoring our invitation. About July sends his apology He's in one meeting in Alausa, so he cannot make this presentation this morning. The students, you're welcome to our midst. The LASUCOM students, the IFE students, the Lorry students, our interns, and the permanent staff. Welcome you all. Thank you very much. Enjoy the presentation.
Thank you, sir. So, okay, so let me formally introduce our speaker. So, like my Oga has said, okay, so our first speaker who is going to be shedding light into this topic is Dr. Oludaisi Oduniyi. He is a consultant, family physician, and geriatrician. I know him so well because he's also my mommy's husband. Yes. It's always hiding, so he's one of my mommy's husbands too. Abi Oga, am I lying? And he's also the head of all persons unit last week. You are welcome. Can you please give your understanding how our answers? Thank you, sir.
This is not the system we're using to project. Then
let me start by appreciating the physiotherapy for choosing me to be the speaker. And let me also say that, let me first of all recognize our own amiable father, the Chief Medical Director, Professor Adito Faba, that has already transformed LASUT to age-friendly teaching hospital. And let me also reiterate that LASUT is only teaching hospital in Lagos that actually have care of older persons units. And in family medicine, we have over 5,000 elderly, and we are still counting it. Now, let me say that the care of elderly is actually everyone's business. In fact, what we normally say is integrative care. I mean by integrative care, I mean that only one person cannot manage elderly. It therefore means we need a geriatrician, we need nurses, physiotherapy, fantastic. We have occupational therapy in our midst, occupational therapy, fantastic, medical social workers, in every specialty as the case is happening. And let me also sincerely appreciate you. Before I start, I would like to say that we actually have a section that actually take care of elderly called geriatric physiotherapy. Is there any section like that? Yes. Let me commend you for that, because elderly, they are actually a special being, and they have to be treated with what? Respect and honor. If you look at this topic, you know, we normally give some information before we start. 187 countries in Nigeria, in the care of elderly, we took, out of 192 countries in the world, the care of elderly, Nigeria took second from the back. So that means we are already, we took 189th position. I won't say it's a failure, but I'll say it's second from the back. I'm going to challenge us that the physiotherapy, the geriatrician, the nurses, we are going to work together to ensure that our efforts that have contributed so much to Nigeria are actually giving the best. And let me say that at the level of national federal government, we have National Senior Citizen Center at Abuja. In fact, currently now they just changed the DG to Akinyemi Obe. It's all about elderly welfare. We're looking at the social, we're looking at everything in terms of the elderly. Let me also say, for you to know, September, we are celebrating World Alzheimer's Days. And you know, Alzheimer's disease is also peculiar among what elderly. Let me also reiterate that International Day of Older Persons
which we've been celebrating in lawsuit. We've had the last year, we had the first edition of International Day of Elder Person. My own CMD, Professor Alberto Kumo, has been very supportive. And I say that I'm seeing it. I know you'll be hearing me now, that I will not actually rest until lawsuit actually lawsuit geriatric center. Center, we can handle the center. In fact, I want to see instead of elderly to meet the specialists will come and meet elderly. So a section will be for physiotherapy, section will be for nurses, the specialists that can actually make elderly to be what? To be great. And I know that CMB hearing me will be in consonance for us to actually have lawsuit geriatric center where our elderly can actually be offered integrative care without moving here, moving here, moving here. Thank you very much. Let's go straight to the topic. When I look at your topic, the topic is elderly aging. Elderly aging for prevention and frailty. The question is, if you look at the definition of United Nations say anybody that is 60 and above. But the WHO mentioned that anybody from 65 and above, you know, it also varies. We use the terminology 60 to 74, 75 to 84, 85 and above is what is old age. These are the classification. Now, when I'm looking at aging, it's sub-categorized into three parts. We have what they call elderly aging. For elderly aging, we can call it successful aging. We can call it aging well. We can call it what? Productive aging. And what is the definition? Definition actually means that the absence of disease, physical and cognitive disability, and that is what is meant by what? Elderly aging. Either you call it elderly aging, or either you call it what? Successful aging. So we now also have what they call normative aging. When I say normative aging, you can call it normal aging and what unusual aging. You will agree with me that what it actually means is that it just means the cellular changes that occur. And that is why you see that elderly will have a gray hair, you know, their skin will be what? Wrinkled. The way they see will become what? Decrease. And even their movement will also what? Decrease. That is what normal aging. I'm not talking about 20. You will agree with me that 20 to actually do with increased vulnerability, cost of homostatics as a result of one little stress. Now, I'll go back to this successful aging, and I want us to actually pay attention. Now, look at the way they say, if they say successful, if you look at for one to say we have a complete human being, we have the body, the soul, and the mind. Number 15 is physical and activity of daily living. Physical and what? Activity of what? Daily living. When you say somebody is aging successful, you are saying that the person actually have one or two diseases, but the diseases is well managed in terms of what? Physical health. So if the person has disease, the person can actually also do his routine activity of what? Daily living. So when you say number one component for you to say somebody is doing well is the activity of daily living, which is the self-care, dressing, eating, ambulating, hygiene, is actually what? Impact. You understand? You say the person is what? Is aging well. The second thing is cognition. Cognition has to do with memory. You agree with me, the person intelligence is still what? Is still intact. You understand? And you will see some elderly in our midst that, in fact, when they look at it, they will say, don't go there. When they say don't go there, you better follow because their head, they still have preserve cognitive function. Now, that is in terms of by what? Biomedical. By what? Biomedical. Biomedical, physical health, cognition, and what? Functional independency. They can do self-care, even complex what? Complex tasks. They can do food preparation, they can shop, they can handle telephone. In fact, there was a period that we do, I did 2021. I got me International Day of Older Person, and we call it digital, the team then, what team there was digital equity for all ages. What we did in care of older persons clinic is that we told our elderly that the big phone we give them, they should go retrieve their phone for their grandchildren. Then we will not put them up for them to learn how to use Android. And it is only Android that the government can hear you that you need your geriatric center. But if you channel, you don't be listening to. You understand what I'm saying? So what we did is that we use that team to teach them how they can be using Android phone, like the channel of those days. And a lot of them were actually happy and they went to retrieve their phone. They got the phone for them. They said, Grandma, this phone is too big for you. Let me be using it. They will not replace it with Nokia phone. I said, go and retrieve your phone so that government can also hear you. So what we are saying is that all those aspects, physical health, don't forget that they have 1 or 2 diseases, but that disease are well managed. Don't forget that their condition is also intact, and don't forget that they can still do self-care and complex care. This is biomedical aspects. When we're not talking about the psychosocial aspect, we're talking about this psychologically, do they have good state of health? We call it psychological well-being. And let me use this opportunity to appreciate physiotherapy again. I know each time I call you for IDO, you send somebody to also, because in International Day of Older Person, we take care of elderly holistically, and we use also the opportunity to recruit them. So last year, with the support of my amiable CMD, we register over 1,000 elderly under Ilera Eco-Stream. So we have to appreciate CMD for that. So psychological well-being, as part of the comprehensive geriatric assessment, we call it CGA. And CGA, only one person cannot do CGA. Let me say, and that is where physiotherapy will also be called to join. In fact, I was talking to somebody in Auto, I said, do you know what they call autogeriatrics? It's not enough to put a cast on elder persons because of Colles fracture, but to do which is multifactorial fall risk assessment, you will know it actually require multidisciplinary care. Because once an elderly had a fall once, the person has another tendency to have a fall again. It doesn't tell me that you must evaluate for intrinsic and extrinsic factor to make the person to fall. It's a family physician, I'm not boasting. I'm doing realize to be the hospital also see elderly people at home. But if they give you can follow, leave them for me. They are my elderly. I'm also authorized, just like physiotherapy, they do home service. I'm also authorized to also give what care at home. So if I see an elderly that is falling, I want to go to the to assess, is it a extrinsic factor that is making that elderly to fall? Sometimes if I say, I call that, I say, this bedroom needs to be restructured. So the other component is social engagement. When you say somebody is healthy, the person can still be able to do what they call advanced activity of daily living. The person can be a leader of elderly group, church, in mosques. You will see them, they are the CDA chairman because they work all the time. At that particular level, they are doing voluntarily work. You see some elderly here, their children are in abroad. They don't want to do that. In fact, we want them to do. You understand? That is, for me to say somebody is successfully aging, you will say physical health, even though they have disease, is well controlled, their cognition is intact, their activity of daily living is still maintained, psychologically, they suffer from depression, anxiety, and 3, they are socially engaged. In fact, myself and my colleagues, Dr. we were thinking that as part of the thing is that if life should give us opportunities, some very successful aging can also be integrated to support some of our elders that come to the hospital. They come to physiotherapy, they come to section. Next slide. I was once a lecturer at University of Lagos College of Medicine, pharmacology. And I teach and I don't lecture. So at the end of the day, this normative aging has to do with not necessarily changes in aging. Let's go to quality. Next slide. Okay. Now, let me quickly say, you can see the physical changes. You know, eventually the organs, you will see that they will shut down in the heart. They will lose elasticity of the organs. So they are prone to developing sometimes the cognitive changes. Let me say that elderly, especially the old elderly, some of them is not forgetfulness in his to develop dementia. So as care, we do cognitive assessment for them. We come to family medicine. See how cognitive impairment. So we pick them here. We can now start teaching them what we call stimulation exercise, which I would say is also in physiotherapy. Now, psychologically, you can see emotional fluctuation often accompanied by increased emotional stability and less satisfaction. Socially, transition from their grandpa, grandma. In fact, you discover that most commonly, I keep on wondering that is it possible for God to reserve all those our home people? Because there is no between computer mother and all those people. Computer mother, they will say, don't worry, use Google Map, you get there. They are not going to spread. For years, to carry we said grammar. Those children are not even remember in the school. The one they carry the students to say, do exam, they wait for them. So we have to commend our elderly. Continue. Now, I talk about 20. Because if you look at Isaac Bernard talk about geriatric syndrome. And this geriatric syndrome, you know, according to Isaac Bernard, initially it was 5. Instability/4. Immobility. Cognitive impairment. So increased susceptibility to drug side effects. They will not also have what? Will not have incontinence. Now, if you look at frailty, you will see that it's a state of increased vulnerability for united decline in the physiological system. Now, there's something they call frailty phenotypes, according to Freud. Freud said, for you to say an elderly is actually frail, that means 3 out of these listed components must be present. And what are those listed components? One, they will have unintentional weight loss. They will lose about 10 pounds. They will be extremely weak. You have dynamic thyroid. The great strength will also be weak, and they will be fatigued. In addition, they also low level of physical activity. Once an elderly has 3 of these, the elderly, according to Freud, is considered to be what? To be frail. But we need another 2. We will say pre-what? Pre-frail. If an elderly, we say robust elderly. So if 60, if someone robust 60, you understand now. That is when we talk about frailty. You can see changes, weakness, slow walking speed, low level of physical activity, fatigue, exhaustion, and unintentional weight loss. Right. Next slide. Now, you can see that here, everything about this person, you can see that is the working frame, which you also teach them here. Sorry, I want to be educated. Occupational therapy, are they part of this department or they are on their own? But they are for integrative care for my Sisi and Bobo. I call them Sisi and Bobo. So instead of you to call me Arubu, people call me for Sisi and Bobo. So you are one of their Sisi and Bobo. So frailty syndrome characterized by reduced strength, endurance, and physiological function. It's not negative, can often be prevented. And look at it. What is your specialty, which is what? Physiotherapy. Look at what I want to do. With intervention like physiotherapy, the is and it's a under physiotherapy. So you can see that so you can see that the key contributors, sarcopenia, which is loss of anything can cause sarcopenia, malnutrition, inflammation, there is chronic inflammation, nutrition, and cognitive. Next slide. Now, this one thing that I want you to do is this. We said components of frailty, they are extremely weak. What will make them to be extremely weak? If not eating cancer, would they not be weak? They'll be weak. You understand? If they have infection, if they have controlled cardiovascular disease, they will be weak. So that's what this slide is showing. Next slide. Now, how do we assess our frailty? In family medicine, we actually assess our elderly, whether they are frail or not. And there are different tools that is being used. Oftentimes, we use Rockwood Clinical Frailty Scale. If you look at the Rockwood, you agree with me that it categorizes them into very fit, well managed, living with very mild frailty, living with mild frailty, living with moderate frailty, living with severe frailty, living with very severe frailty, illness. Whether you like it or not, even when they are at the terminal end, as Dr. Duni is moving, so also the physiotherapy will also be moving. If we're actually doing preventive geriatric physiotherapy care, you know, we know that they are going to have diseases, but we still want them to be in clinical frailty scale stage 1 still, which is managing well. They will not be actually achieve very fit, but if they suffer from common diseases, common disease should be well managed. So, frailty scale, and you see frail here, these are in a building clinic. We do frail questionnaire screening to, are you fatigued? Cannot walk up to one flight or stair, cannot walk one block, do you have more than 5 illnesses? Of course, those are multi-mobilities. Those that have and don't forget that we have both multi-mobility and comorbidities. All these things can actually put them to frailty. And the way in which we also assess them, because the comprehensive geriatric assessment, which is the physical domain, we ascertain nutrition. And we say in the past, have you lost up to more than 10 kg in the past 3 months? And once you say yes, we know that this elderly could be suffering from malnutrition. Let's assess what is causing what? Malnutrition. And that is why I normally try, in fact, step out my elderly, now that I touched Timothy, I got think I really my elderly. So thank you very much. Next slide. So you can see every successful aging, aging minus what? Weight. That is the mathematical what? Mathematical definition. Explain to you concept of what? Or successful aging. So the component of frailty should not even be present. And how is it going not to be present? It therefore means that everybody should join hand. In fact, every person cannot take care of everybody. And that is why one of the things that we are doing, and we're still going to get to you, is that I pray that if we're able to have Lasso Geriatric Center, in fact, if Ijesha people could contribute money together and do Ijesha Land Geriatric Center, why not us? Are you getting it? So, CCG, Mama, as I finish with you, see physiotherapy, as I finish with you, see dietetics, as I finish with you, saying they should not die. But even when they want to die, they should not die in pain. That's what we are saying. Continue. So, vision, this one, United Nations Decade of Healthy Aging. You can see 2001 to 2030. And that is why the United Nations, every October 1st, we celebrate International Day of Health. And what we pushing for the decade is what? We want aging, we want successful aging. Continue. So, functional ability, this empowerment, you can see functional ability to be, they have reasonable to value. So, in geriatric, we talk about the geriatric 5 M's, and the 5 M's, what matters most to the elderly is actually a patient-centered care. I came today, Dr. Dumi, my concern is that this drug, can you help me to look into it? And I shall do that. Because if you don't address what matters most to them, you'll be wasting time. You understand now? So The first M is what? Mattermost. The second M is what? Mobility. And mobility has to do with what? Form, gait, and balance. Which physiotherapy like you do gait and balance evaluation and management. Then we talk about the mind. Mind has to do with cognition and depression. We talk about mental complexity. We suffer cognitive diseases, but are these diseases well managed? Then the last is what? Medication. So, at every consultation, you also come for consultation. Ask them what matter most. Do you come with osteoarthritis? In this encounter, what are those things that you actually want us to look? And that means that you are also taking cognizance of their values, their goal, and what and their preference. Are we getting it? So it should be a patient-centered physiotherapy care. You understand now? It might be that you want to do it far away, it might not be matter most to that what to that client at that particular time. And we'll be happy if you are able to address what matters most. So our goal is for injury. In fact, do you know the song that normally to my elderly? See that you always point out in the future. In the future, I said, somebody say inside that place, Mama, I should not go. I must listen. You must be there. And so the truth of the matter is that is to maintain their muscle strength exercise. I'm sure you know about one first, and then walk, short physical, things we do in family medicine too. But the truth is that for us, you integrate with us, I'll just say, Mr. Sadi will take charge, and I will do the other component of the health. Thank you, sir. Continue. So the salient evidence, understanding for them, saying we talk about geriatric syndrome, and one of the geriatric problems that they often don't report is the issue of fall. Especially when that fall is not an injurious fall. But in family medicine is that in the past 1 year, have you ever had a fall? From that simple question, which is a simple subsequent fall, we can know what the fall. So, as part of, I mentioned the 5 M's. The 5 M concern me and you, which is the issue of mobility. So the question is, I don't get to say, because do you know the cause of Siemens free? You fall. Sorry, you is congested. It might not be dead for you. They might not be dead for you. So 4. In fact, it's even better. In fact, the man of our elderly, when you just tell them issue, say I must not 4. Because when you go, you should not go at night. You can have what go in between. Do you know all these people that you can make them to fall. They will know that they are on. Before you know it, they will shake and they will love their Bible and they will fall. So oftentimes, it's a silent geriatric problems, especially when they don't develop what injury. But don't forget that psychologically, you know, I mentioned that successful aging, they should be psychologically well adapted. Once a patient falls, second, what will happen? They will have low physical activity. Fear of falling syndrome. And if they are sitting in one place, they have the conditioning. Great. I hope you enjoy. So, if they fall, we are not talking about fall that they just put what's it called? The falling ones, the falling second. If I saw the best there, more did you? In fact, let me stay. I have this 7-story building. See that the woman died. The person has fallen twice. In fact, we said, "Mommy, relocate." So what he did is I attached her to this. Because what do you think is happening to that woman? Fear of falling. And sarcopenia, the conditioning. Because don't forget that certainly in such woman. Okay, and you know that we do in conversation. If you look at your just on your own. I say I'm not that in fact only on the 7th floor. You call all the children. Well, don't you think that if you come and also integrate so maybe it's even coming down in payments. I've done it 52. I can remember justice 2004. Cognition was still very intact, but the man was virtually impaired. But he has mastered, at Ilupeju there, he has mastered all the rooms, no matter how big they are. And once you greet him, you say, is my doctor. So the salient evidence is understanding 4. Next slide. Now, if you look at 4 in cases, you will agree with me that the cause is multifactorial. In fact, there is something they call intrinsic. It has to do with issue with some internal personal factor. You understand? Like, you know, sex, you can change it. Old age, you can't change it. You know, and is 60 to 74. For old is 75 to 84. For old age is what? Is 85 and above. And you agree with me that the memories they are also prone to what? To fall. All those intrinsic things, age, sex, even some internal uncontrolled medical condition, it cannot be well. We can only be positive and achieve what well control. So all those things, you know, include multi-pharmacy. Don't forget that they will suffer for it. Two, so I have that this. So what we do is that we prescribe. In fact, what we do is to do medication review. So once this condition is well controlled, we stop. So that, you know, don't forget the side effect of those drugs. So hypertension. Don't forget that some drugs can make you to feel dizzy and fall. Don't forget that, you know, side effects. And don't forget that elderly are also, you know, one peculiar thing that I love about elderly, yeah, they are doctor, but they take medicine for everyone, including Shidi, that is giving them prednisone. And you know, don't forget that if you are taking more than 5 minutes prednisone every day, you are going to develop 7 diseases. You end up to see what physiotherapy. Because you need to also teach them balance what exercise. Are you getting it? So those intrinsic factors are there. You know, patient-related issue, psychological, even medical, and you know, aging well, the palliative disease, but this disease must be well controlled. Disease can also come into fall. For example, now, one day I was called, and the new they have that, you know, we say 10 international units insulin. The person withdraw 100, the man just went into hypoglycemia. After that day, they stole my phone. You understand? But I was able to salvage life. So, you know, all those medical conditions, you know, we are not going to see glycemic control, or that you teach them to. Season factor has to do with their environment. And I'm happy that you don't go to their house to also evaluate. So as part of one of the things I should do is that if their house is not well arranged, if they don't have Andre, if they don't have bar in their DC, all those things need to be what recommended. If the light is not well illuminated, the situational, they still smoke, and not only they smoke, they take alcohol. Not only they take alcohol, they also take other drugs that is not what prescribed for them. Next slide. So you can see that the body is much. As at 214, 29 million fall. Out of 46 million. As at by estimated 230, it will be 409 million fall. The question is that the cost indicator of fall not be to do. Can you tell me be to do? Because if you fall, no surgeon will not do exploratory work for you for free. You might not even see dead. And even when the surgeon finish, everything will still come. You know, hospitalization, physiotherapy will come in, they will do physiotherapy, you will be spending the money, you will not come for free. So you can see next slide. So you can see the plenty risk factors. In fact, I've categorized it into modifiable and non-modifiable. And I mentioned, now let me quickly say that age older than above 90, arthritis, cognitive impairment, dementia, female, history of fall. Previous history of fall is a risk factor. History of fracture, white race. Now, you can see that, now if you look at this and it's peculiar to you, physiotherapy. Look at the musculoskeletal. You work with musculoskeletal, I mean, and balance impairment, foot problem, gait impairment, limited physiotherapy. And you know it's modifiable. So we have a lot to do. In fact, I know you want to do balance and gain exercise at home. Stylishly, I want to maybe even see the toilet the mama is using. Because it could be the excessive factor. It's not enough for you to say, okay, let me be doing the massage. You still need to inculcate preventive things. Next slide. So I want to leave you with this limits. And if you say your elderly should point out the most necessary, I also tell you that they should see our root family. I will follow just summarize the causes of falls in elderly. And you know that we are dealing with a lot of osteoarthritis that can actually come to fall. In fact, do you know that elderly? They don't want to use assistive device because they are looking for boyfriend. They don't want to use it. In fact, I've seen one elderly that have, knee bones about 5. Different assistive device you not use. So I don't know if they want to use assistive device. In fact, I normally tell you that if you're walking like this, or you're walking like this, genovirus, you not see us brand new. But if you use an assistive device, you still shakosi. Someone will call say, "Can you be my baby?" You understand what I'm saying? So I think for me now, hypertension, in family medicine, is that we check at the initial assessment, we check their BP, sitting, standing 5 minutes to assess postural hypertension. You can look at medications that can put them to move postural hypertension and see what is the need for reduction or to stop. Auditing and visual, integrated care. Eye people must come, even if they talk about they should see eye specialists at least once in care. They should also see ear and see infection and not very good balance. So tremor, there is for Parkinson's disease, what do you call it? New physiotherapy. Also maintain their gait and balance. So you could have problem, foot problem, arrhythmia, ECG, disconditioning, illness, nutrition, and gait disturbance. So I these summarize the risk factor for 4. Yeah. So intrinsic, you've seen it. Intrinsic to review the patient. You've seen it as a result of neurological issues. Hemiplegic gaits, Parkinson, shoveling gaits. I mean, so medication, 4 is increasing drugs. 4 is what? Majority of them, they abuse what? Diazepam. They abuse Lorazepam. And part of this, it can cause incoordination and they will fall. If they fall, I feel that they should not, it's just a low injurious fall. If it's injurious fall, you've seen it, syncope, atrial fibrillation, and co. Next slide. So medications, you understand now? Medications that is quite, elderly. You know that they don't only have arthritis, but as simple as tramadol, as simple as cocodamol can make them to feel dizzy because you affect their neurological and they'll fall. So as part of what you should check, even with Lexotan, sedative, we discourage it. This drug that is listed, they call it fringe. 4 is increasing what? Increasing drugs. So as part of managing for a patient that asks for, they must come for medication review. That is what I did pharmacology and we start in geriatric therapeutics because of my elderly. So if they have issue, don't do interaction. And also sort it out in family medicine. Continue. So you can still say urinary issues, continue. Social issues, issue with psychological, if they are depressed, they are thinking, they can miss their step, they can fall. If they are malnourished, you understand, they can fall. If their moving is already, reduced moving strength and quality, sarcopenic, they can fall. If they are suffering from chronic are also continue. Now, look at this restrictive thing. Now, look at that thing. Look at how this house is. Can you identify who can make them to fall there? Eh? You can see that wire. It will make them, and not only fail. You understand what I'm saying? There's in between the eggs. Even surfaces, slippery, the ground surface is there. So you just flip. You understand? Even if you look at the lights, if you enter that place, I don't know, don't enter inside computer. If you enter that place, you know that can actually also pull them to fall. So environmental thing looks like inadequate electric cord on the surface, not to grab back. The other I will say, I don't want to grab back. You know, assistive device, OTJ. You know, when they come to see you in physiotherapy, you also say, Mama, let me check your stick, let me check your key, to be sure that whether it can also make them to sleep and what and fall. Are you getting it? So continue. So causes, effects. You can see that I've listed all these causes, but the effect, physical effects, head injury, collis fracture, all those things. Immobility effects, mental is what? Fear of falling. And that's what we use for efficacy scale. FES1 to assess if they are having fear of falling. Then social, don't forget, they might be in home for long. How many homes do we have in Lagos State? Everybody is busy. Everybody is at work. Next slide. I'll soon finish. They are enjoying it. So, yes, situational, patient judgment, overconfident, reluctant to report for, don't forget that. The inability to get up. Now, next slide. I want to talk about this. I know I've looked at the topic extensively, but let me quickly talk about this. Please and please and please, for people that are that handle elderly, that look at their gait and balance, do opportunistic health finding. Even though they come for other things, other issues, in the past 1 year, have we ever had a fall? There's something they call 3 key questions that you must ask. Are you afraid of falling? Do you feel unsteady while standing? In the past 1 year, when they say yes to it, you know that, if you look at the population, categorize them into low risk, moderate risk, and high risk. Physiotherapy. In fact, mother is my wife. You understand that? Yeah. So, opportunistic case finding, very, very important. If that fall is a severe fall, severe for me, I fall. I was on ground though, for like an hour. I shouted, nobody was around. Everybody is at work. I can't get up by myself. I fall, I sustained head injury, I lost consciousness. They are severe, and you have to act appropriately. Please. And that is why, when we say, one of the things that I do is that I tell them, I must not fall. I must not fall. I must not fall. And if I fall, no matter how small it is, you must let me know. So that because one single fall is a warning, fall. For example, forget is the bone has turned to biscuits, kaka biscuits. A little fall will make the bone shattered. And if it's shattered, they might not be. So right, is that as part of the fall prevention, when you talk about, I know it's going to prevention, is FRA, multifactorial fall risk assessment. In fact, the first prerequisite for fall prevention is to assess for risk of fall. And that question, that fundamental three question must be asked when you have a encounter with any elderly. Next slide. So I'm sure you know about time of and go test. You do it commonly. It makes us to know mild, moderate, and severe immobilities. Abi? Next slide. So advancing geriatric care, holistic approach to fall prevention. Next slide. So you can see the 4 P's. The 4 P's are what we do to actually prevent fall. And I will talk about predictive. Predictive has to do with comprehensive assessments. And that's where multifactorial fall risk assessment come into place. You ask them, even if they presented with fall, you ask them events, what happened, how did it happen? You check medication, you check this, you check that. You might not be able to do it by yourself, but you could also refer to the appropriate court order. Dr. Duni, this person had a fall. Before I will now think that is due to gait and balance issue, can you assist me to assess for all these factors so that we can work together to live longer? So nutrition, osteoporosis, if food rich in calcium and vitamin what? The question is, in Nigeria, can we still eat food? But the thing about our vegetables, I tell elderly, don't eat the yolk, eat the head, eat proteinous food because they tend to have negative protein balance that can actually lead to sarcopenia. Then physiotherapy, come and do multiple exercises. You understand now? You notice that the muscle, there is already sarcopenia. Don't wait. Can we help you to do resistance training, endurance training, one-step test? Then we talk about personalized. Personalized has to do when you assess and you discover that this is actually the issues, if it's as a result of cataract that is making the person to misstep, you will now personalize and say, please, Professor Adekoya, please, can you help me out to assist, to do something for this cataract so that it will use, the person can see and the person will not fall again. Are you getting it? So depending on what you think, you will also know what you have to do. So participatory is, I'm calling on every healthcare worker that only Omoni cannot give integrative care for the elderly. Mr. Fadeli, join with me. My stepdaughter, join with me. The physiotherapy, she's my friend. Join out with me to make sure that when you see elderly, give them specialized care. Separate the feet from the shaft, and they'll be happy with you. It's a multidisciplinary. Care of elderly is everybody's business. And I would like to stop here. Thank you for listening, and thank you for inviting me for this presentation.
Thank you so much, Frank. I will continue the good thank you so much, Frank. And I think I really need to work. And if I got anything from this school and it's from I would say epidemic. So it is our responsibility to always look out. If you see anything that is here on the I'll be about calling because yes, now that's our my mom, like I said, my mom has he has been my mom's generation for like years now. So ask them questions from our everybody, anything because they don't have to compete to one about anything. A lot of sometimes it is great to speak out. Now, giving if you have any question, you can write it on a sheet of paper and post it. Now, I want to important and using German and English. The channel Jimmy TV and S1 to join them. Goodbye. Well, thank you so much for joining us. So we want to watch much of our time. I'm going to quickly call on the second presenter. Inviting everyone to they want to say sorry. So to share your perspective. Thank you. Good afternoon, everyone. But I really everybody we are coming on my slide. Everyone is very and important about this because in in like having wrong and even though there's actually a story that shows that within a year after a fall that resulted in a hip fracture, there was a 20% risk of death in the older person. And I was looking at the fear of falling, which resulted in them in condition there is also like a fear of falling and then usually is a higher risk for falls. And one of the important symptoms of pregnancy is muscle weakness, muscle loss, which is sarcopenia.
minutes, please. Thank
Can we go to the next slide?
you. Sure.
Started having mass. Next slide is what's wrong? What's wrong? The trend and they become smaller. And this will make it activities like standing away from sitting, looking, which one they have standing up and sitting. Can we move to the next slide? Can I read myself? Okay, so this is the standing for a chair, unintentional. Is it loading? Standing and walking, that's what we talk about and dynamic balancing. We are going to stay upright and stay stable. And the thing that we need to body control parts of the body. The ear, the comfort in the ear, the control the balance, but the is to see the difference to have vision your vision is very optimal. And also we also know the muscles and the joints that as I mentioned before, that 20 years and there's no time that there is and then start becoming control. There are some things that might cause disease or might cause confusion. These are things that might affect the person's balance. And then conditions like stroke and Parkinson's, which directly affect the person's balance. And
Okay. No, no. Question. Mommy, I said
have in the house, then you go at there's no
Yeah.
certain kinds of food where it's not affordable for volume. So foods are slim and that is not really access to their food and you have a human of 5 which is too high for an older person to work. And also you use of women when they are needed. So you have something that is that means they will be which is very important for the right person to train by a physiotherapist. When you also mama you don't always sit and give it to them. That's what actually that's the approach for them to use. So this is the working is another person working around the house, and then we have trip on this wire now, and it's very important. Attention to this thing. Only for the physiotherapist, because something that everybody comes together and we go to look at the things that are looking to make it simple and so the next steps to reduce the risk of problems. So the strategies focus on both the intrinsic factors, that's the internal factors, and also the extrinsic environmental factors. Strategy informed prevention is necessary. As you said, the things that increase the risk of is loss of balance, also muscle weakness. And those are two things that exercise is very effective in taking care of. So, and also I walk around, they might not necessarily address the deficits that they have. So we need to be the other person needs to be assessed that the therapist know, okay, this is the aspect that they need to work on, the kind of exercise they need. Not all exercise is exercise, might be particular place that you need to address to improve the balance or the strength of the individual. A lot of exercise help us to improve balance, strengthen the muscles, reduce the weight and associated injuries. As the amount of and the friend associated injuries that if eventually this person does fall, we need to reduce amount or intensity of injuries that we have from the phone. Exercise also helps improve how function and cognition, the confidence of the individual. We said it before that people that fall before, they develop the fear of falling. So this exercise makes them feel better prepared, boosts their confidence, and reduces their fear of falling. Next slide, please. Different kind of balance exercises that we sometimes do for our patient. Next slide. Here we see a patient trying to step up on a board. These are some kind of exercises that we do. Then another strategy is regular health screening. So to make sure that if the person has not fallen before, or if they have, that we want to do check-ups on them to prevent to target anything that might be going wrong. So once you do regular eye exams, the person might not say, oh, I'm not seeing wrong, but they might not be seeing it. They might not even realize that they are not seeing it. So once you take them for regular eye checkup, you want to check their blood pressures, their blood sugars, things like that, and screen them for their cognitive function. You also want to review their drugs. Any drugs that might be causing dizziness, drowsiness, low blood pressure, as I said, orthostatic hypertension. Want to address all those things and make sure that they are in place. Address post-pharmacy records. Apart from the drugs that the doctor would have recommended, people, neighbors, everybody would have recommended, mama, use this supplement, use that thing, and some of them, they don't even know what's inside, and there are so many drugs apart from what the doctors have recommended. So we want to address all that. We want to make sure that the medication you are taking is absolutely necessary. You want to monitor sedatives, things that might make them be confused and not be very alert and increase their risk of falls. So you want to monitor all their medication. Next slide. So a very important part of the prevention strategy is home environment modification. This addresses the extrinsic factors. So we need to make sure that as much as possible, we want to remove things in their environment at home that might increase their risk of falls. So, for example, now you want to make sure that you're using non-slip towels all over the floor. So, you want to make sure that whatever towels that they have on the floor of their house, especially if maybe you are doing recent renovations or things like that, you need to make sure the towels are not very skinny, glossy one. And also, people that live with elderly, you want to make sure that as soon as things like water spill on the floor, they are cleaning them immediately. Because you the younger person might not have a problem when try to sleep on wet floor, but an older person might not be able to handle themselves as well. So we want to make sure that they are using non-slip towels all across the house. And in place where the towels are already on the floor, we cannot ask you to do them if you can't afford to. So you can install non-slip mats that we would place on the floor that would be attached to the floor and have some kind of friction and prevent sleeping on the floors. So in places like the bathrooms, I go to the next slide. So in places like the bathroom, are non-slip. And in places where you are sleeping, you want to non-slip styles where there is some kind of tactile texture that will allow the place to sleep. And if the floor is already a slippery kind of tiles, you want to install non-slip mats like rubber mats that will be used for. You also want to install they can before that happen in the house, happen in the bathroom, like and then you sleep and so that will be common thing that we do. So install non-slip mats and also the use of bathtubs for older people because they come in and come out of and they are also slippery. So we want to, as much as possible, discourage them from using bathtubs. So if you already have bathtubs in the house, that might be a modification that we want to do. Next slide, please. So if you want to remove this one, like in the picture I showed earlier, all the lines that are in the house, we want to make sure that they are to corners where the person would not have to walk past and cause them to trip on them. We want to remove no tools, no chairs along the path that the older person might be walking past. And then we want to tolerance seats. So tolerance seats are able to be very long and it makes it difficult for an older person that is trying to sit down or stand up from them. So this seat or even the sofa in the house is quite long. When they are trying to sit down, of the symptoms of fatigue is difficulty standing up from sitting. So if the person is trying to sit down or very differently, they are trying to sit down because they are going down and at the point they can lose their balance trying to go down to that surface. And also when they sit down there, it will be difficult for them to stand up from it. So we should try to and then don't rush to install for ease of seeing. So we need to ensure that in the space we are living, and because we're in Nigeria, we don't also have lights. We want to make sure that strategic places in the house, we have lamps, we have torch lights. But we don't have lights. So we have torch lights and lamps that Mama will be there should be a lamp that she can just reach to and turn on so that she can be able to navigate around the house. Not that when the light is on, and Mama is not trying to go to where the thing is and then she falls. So we don't want that. Can we go to the next slide? So we have the identification of the toilet. So you can get these toilet commodes that you can place on the toilet, and these things have adjustable height. So we adjust it to the height that is comfortable for the older person to sit and stand up from. Next slide, please. So, okay, so let's do this together. This is the power pile, and then we're going to look at the 12 pieces that are in this image. We're going to do something else. At some point, and the person goes to working class and just trip on it. Also, look at the one as well. Mama could be going to one stage and she's tripping on things like that. Next slide, please. So, it's quite, even when you are sitting down and you are able to sit and stand up. Also, there we see a battle. Mama wants to have a bath. All of the personality was as sleeping. Someone could even have their bike and drop pieces of soap or detergent on it and even making it more slippery. And then mama is trying into the bathtub. Is a recipe for disaster. So you want to address this issue at your house and see what are the things here that might be a fall risk for this grandma or grandfather staying with us. Next slide, please. Okay, so what are we going to do? Another thing I need to look at back. The photo that the person is going is non-skin that it has some kind of functions. And then when you close that we don't want them to wear skin pads. Something that is strappable to the foot that will stay on their foot. Avoid working with socks and bare feet indoors. Next slide, please. So this is an image of a typical safe shoe for an elderly person to wear. The sole is textured and grippy. It's closed back. The sole thickness is ideal. Can we go to the next one? You can be wearing sneakers around. You can also wear sneakers. Also, I don't know, this should be looking for someone like another person that has diabetes. Because sometimes when they have diabetes, they the tips of their toe and they trip and hit their foot on things. So their toes in case of things like that and prevent injury and reduce their risk performance. Next slide, please. The movement or the working and there are some properties of the working because like I don't use at all. So you need to make sure that the only thing the person is doing is the weight and the type for whatever condition that they are using it for. And then you want to make sure the person is avoiding leaning on it heavily or incorrectly. And yeah, so these are different working aid types that an elderly person might require, like be a Zimmer's frame, an auxiliary crutch, a walking cane, whichever one. So your physiotherapist, this is the type of working aid that you need, and then show them on the proper use of it. So this is someone showing the use of Zimmer's frame. Next slide. Okay, so in as much as we have tried to put things in place to prevent falls, we also have to be prepared for the eventuality that there might be falls. So we want to create a fall safety plan. That is something that, okay, if an elderly person falls, how do they come out of it? How do they get help? So one thing we can do is to arrange for a trusted neighbor or family that is not so far from them to check up on them occasionally. So the older person might have either, but in some cases, the person might not be able to get access to their phone. The person has fallen, has developed a fracture, can move from the bathroom floor. You may not be able to get to the phone. So in that case, you need to equip the person, the other person with this phone or the well that they carry around with them, even to the bathroom, so that if in case they fall and they need assistance, they can just ring the bell or go to the whistle and get the attention of whoever the or family member that is around them, and the person comes and the person knows that when they hear that sound, they need to go and check on the person and help them. Next slide. So I'm checking with them daily. So maybe a dad, a mom that is and around them to do them this. My daughter's really morning, I'm going to come to this person and check on them because apart from the fact that before they succumb to injury, sometimes you now and they cannot stand up on the and they will do which is a big cause of death in older people for the and they're not able to stand up on those to get help. There's nobody around them. So you need to set up things like calling has access to Wi-Fi and is controlled with technology. We can also set up voice activated devices on their phone. And like now, we know that we can just say, okay, so person. So if we can teach our other people how to use things like that, you know that mama, if something happens and you cannot reach your phone, you can just shout this and then you the activated command to call for help. So we can and then the phone just immediately calls the number. Next slide, please. Another thing that we can do for that can affect having that have the technology since when a person feels something, person might fall and they might be unconscious. I'm saying, my daughter, and for people that are still conscious. But in cases where the adult is not even conscious, has fallen down and have their head and has a baby and they are not even conscious, they have resources that and then the research tells us the thing like the older person does not respond. It is programmed into them to call a particular number, to their family member, to call them to get the attention of the person that this person has. So these devices can automatically detect a heart fall, and if the user does not respond, can send an alert to this location to selected contact. So we're looking for people that can afford it and are comfortable with technology. Next slide. Okay, so I was saying, I want to learn phones. We want to teach people, we want to do the things before. And we need to do better online. People we have head injuries. So things that we need to keep in mind when training the person on how to fall safely. We want to teach them how to protect their head. We want to make sure that when the fall happens, we tell them to tuck their chin so that if they fall backwards, the first thing that lands on the floor is not their skull, it's not their head. So we want to teach them, when they are feeling. So there are fall prevention programs that other people can go through. It's not just something that we say with mouth. You have to train them on how to fall safely. So by the time they are already prepared for it. So we want to teach them to check their chin to protect their head. Avoid sticking the arms deeply to stop a fall. This can cause this fracture, like he said, it can develop a Achilles fracture. And you want to prevent it. So it's better to things to the and to the fall rather than trying to fall stiffly and hold on to things. And also teach them to learn on some areas like the thighs and the buttocks, right? Can we go to the next slide? Okay, so these are examples of the prevention program that elder people are going to teach them how to fall forward, sideways, backwards. So deeply out to brace from the fall. So I think deeply and landing on some that might cause injury. That falling, they are taking their head so that the head is not the first thing that lands and goes into the floor. Okay. Next slide. Okay. So what happens now? So stay calm. Check for injuries. You want to check over the body. Is there anything visibly broken, anything bleeding? You want to check for bruises, deformity, any severe pain, anything like that. If there's someone with them, ask them if they are dizzy, they have severe headache, which might be a sign that there's a brain injury. Check for if they are conscious, if they are around them, check if they are confused, if there's a fracture, if there's any of those things, if they are bleeding, they're having any severe pain, you call for the emergency services immediately, or you take them to the hospital. That's right. So these are emergency service numbers that you can call within Lagos. You know the 767, you know the 112 numbers that we can call for emergencies. Next slide, please. Okay, in the case that there is no serious injury, Trying to on the floor there and come into a kind of crawling position. So after they go into that crawling position, they are moving on to their hands and their knees. And then from there, we can crawl to a space, maybe a bed.
Demonstrate that. Can we demonstrate that, please? So you can continue. I'm going to get a mat so that I can show what you mean by it.
So try to get into crawling position with their hands and their knees. And then mat to a stable surface like a chair or something they can hold on to and then use to support themselves. So if they fall in the bathroom and there's nothing to hold on to, where there's a bed or a chair or a table and then hold on to put their hands on it, their foot forward and then slowly try to stand up from it. Where the person does okay. Am I the one that's falling down?
Okay, so
the person has fallen.
the model should I go before? Okay.
Okay. So the next thing we're trying to get into is so you
Going to
okay good that position and now to where the chair. Yes, like that, and then try to stand up, resting on that. I guess, so, yeah. So, yeah. So that's yes. So that's what they also showed here. They get to a 4-point kneeling position, get to a stable structure, and then try to rise up from there. And after sitting down, let the person examine themselves, calm down, notice if there's anything wrong. Move on to the next slide, please. So even if there is no fracture, there is no pain, it is still advisable to go to the hospital to see a healthcare professional because sometimes the symptoms might not start showing immediately. It might be after a day, it might be after 2 days, and by the time you start seeing some symptoms, it's too late to get help. So it's still advisable to see a healthcare professional just to be safe, because there might be hidden bills that might not show up immediately. And also because falls usually are a sign of an underlying issue. If the person has fallen, it's likely that it's because they have an issue with their balance. There might be a neurological issue with their brain or things like that. That might have been the reason for the fall in the first case. So you want to still go to see a healthcare professional to check for what are the things that might have caused that fall so that to prevent a fall in the future. Moving on. So in conclusion, what is healthy aging? Being able to still do what matters to you as you get older means being able to stay active. And being active reduces the risk of frailty by up to 41%. So while you are still younger, staying active even as you get older reduces the risk of developing frailty, muscle weakness, things like that as you get older. Friends are often avoided by exercising and making some important changes. So funds can be avoided by engaging in regular exercises, making sure that you are following your physiotherapists are set out for, and also making important changes in your environment, your medication. And any risk of chronic diseases and improves your overall health. It is never too to start yourself. It's not only about it's not really about jumping up and down. So much that you and go to the gym and start flying up, and it doesn't mean that strength training helps at all ages, and physiotherapists can help you and show you how to do it safely. Physiotherapy design personalized to improve your strength, balance, flexibility, and coordination. So these are some 4 prevention steps that we can do at home. Do we want to do that together now? We can stand up. So, beautiful. We just try to and I will without holding on to stress or okay. And speak and stand
I'm sure so.
and stand. Okay, now good. Another thing we should do single level standing. Okay. In front of you. Okay, yeah. Okay, yes. So advice in front of you, if you need it, you can hold to that chair. I would just want to try to stand on one of your foot. Let's try to do that. 1, 2, 3, 4, 5, 6, 7, 8.
Yeah,
2, 3, 5, 6.
yeah, using
7, 8, 9, and 12. Did you want to stand up? Down, up, down, up, down, and up. Okay. All right, so these are just some exercises that you can do. Although that you do yourself, then will outline the things you should do, the exercises that benefit you. Next slide, please. Okay, so in final thoughts, we still have to have issues. If you or business, it might be a sign of something serious going on. Get help early. Let's protect our older people together. Thank you. Thank you very much for more than to say. So, what I tell my patients is that the ultimate is not just to manage conditions. You're not coming because you are sick. You don't have to be sick before you come to the hospital. Once you see that something, you don't have to see that something is. Let me into the condition. You don't have to. You have this type of. You have education your education Mr. Adjusi, is one of our senior and like thank you so much for coming. The end of admin department, our staff. You guys are amazing. So thank you for the So you call Nigeria Limited. Investing or losing to do to come and give them share their life and their purpose to you should do the we have an adjusted journey and share more life and so that we can learn two things from that. But thanks from that, I want to questions. It's question and answer time. Share that you have questions and anything you can understand. Okay. For Dr. Rooney, because I have an elderly, even though my dad is stubborn. We ask a question. Okay. Okay. Sorry. You can put it there. Stubborn. If we don't go to the hospital.
Use the mic. Good morning, everybody. Good afternoon, everybody. My name is Sheikh Maladi. So I want to ask if an old person can be using all this treadmill
Where is Mr.
Yeah.
Yeah, we are going to take the question one at a time.
I think before you tell anyone that to commence exercise, you actually need the guidance of a physiotherapist. And there's something that we do is that we do physical activity questionnaire to be able to be sure that that elderly, when he's commenced physiotherapy, will not slump or will not suddenly dizzy and cool. So my own advice is that exercise is actually individualized. Individualized is in a sense that, depending on the medical condition of the patient, it is the physiotherapy that will now recommend what type of exercise the person can do. So if it says that the person does not have heart issues, or the person can withstand that type, because there are different forms of exercise. There's one they call balance exercise. There's one they call resistance exercise. There's one they call aerobic exercise. There's one they call endurance exercise. There's one they call muscle flexibility exercise. What I mean is that the kind of exercise differs in individual depending on the background medical condition person is doing. So I would say that before you tell your mother or your father to commence exercise, you need to bring your father or mother to a geriatrician like us, so that we now assess that this person does not have hidden issue that can actually prevent the person from doing the normal exercise. Or depending on what we notice, we can now recommend that this is the kind of exercise. Supposing the person has uncontrolled hypertension, the BP is high, or the ECG, there's a test that shows how heart rate. The person has issue with the heart rate, and you tell the person to exercise. Depending on the, so how is that number one? You cannot just tell anyone to start exercise without consulting the physician first, and the physician will also direct the person to physiotherapy. Physiotherapy will guide on what kind of exercise the person will do, and the person will do exercise and stay. And let me just say that exercise is not by going to still. You understand? You can do exercise anywhere. I tell my elderly that you can even, as you are
sitting down, you can be doing exercise. You can dance for God. You can do like this, provided that the table is okay. It's also in form of exercise. So you don't have to go to stadium before you say you do exercise. But exercise is a planned, structured, physical activity. And because exercise medicine, exercise itself is a drug, you need to be guided. There are principles of prescribing exercise. We call it FIT principle: the frequency of exercise, the intensity of the exercise, the type, and the duration of the exercise, depending on the medical condition the person is having. Thank you very much. Let me give it to my colleagues, PT Fanny Moku, to also shed more light on exercise. Thank you.
Yeah, I said there's nothing I want to add to it. I wasn't here for the question.
We want to appreciate you for this section. It's quite a wonderful, despite coming is the little I heard is quite interesting and educating. So always we have, he said I should ask. My name is Mrs. Adeoti, sorry. He said I should ask because what I notice is that almost every day goes to the washroom for like 5, 6, 7 times before the day breaks. I'm talking about in terms of his urination. So he said I should ask that what is likely because of that, and also weakness in when he gets to move, he works a little, and he gets tired easily. So those are the questions he said I should ask. Thank you.
Thank you. Thank you very much, Mrs. Adeoti, and thank you for being our girls. I want to say that number one, care of older persons is actually everyone's business. So I will say that we have care of older persons clinic at Family Medicine. You can actually, I will avail myself to see you on Wednesday. So I will assess you so that I will now ascertain the reason why you're having frequent urinating that is disturbing your sleep. And after assessment, we might also know why you're having muscle weakness. Then if there is a need for me to also refer you to physiotherapy, I will do that. But it's something that can actually be managed, and we are here for you. LASUT actually carry first, while other teaching hospitals follow. Thank you.
Any other question?
Okay, so I have a question here with me. Is there any school in Nigeria that offers geriatric nursing for RN/RM and PhD holder for the doctor, please?
Okay, thank you very much. Now, thank you. Now, currently, University of Benin Teaching Hospital, they've commenced gerontology nursing. And, currently now, actually one of the pioneer geriatrician trained by Chief Tonianini Geriatric Center Ibadan. And as I'm talking to you now, I'm also doing a program with Royal College of Physicians Highland on geriatric medicine. And the aim is that we want to see how we can carry Nigeria from 189 position to first 10 position. So I want to say that we are, in terms of this specialty, it's actually very scarce. In Lagos as a whole, we're not up to 10 geriatricians that is actually addressing over 3 million elderly issues. As I'm even talking to you now, I'm seeing one of my elderly this evening. So I want to say that I want to use it to encourage us that care of elderly is everybody's business. And Nigeria is trying their best to actually, currently now on the aspect of the doctor, have already approved medicine under National Postgraduate Medical College of Nigeria, and they are also trying to train geriatricians. But so far, the geriatricians we have in Nigeria are foreign trained, and majority of the family physicians, some of them so specialized in geriatrics like me, and we went further to Ibadan. Like currently now I'm doing course in Ireland that we actually make me to be a certified geriatrician. But the truth of the matter is that I love elderly with passion. Since I graduated in 2005,
I've been taking care of elderly, and I can say that in the past 20 years, I've been battling for the elderly. I've seen elderly across Nigeria, and I want everyone to join me because whether you like it or not, the world population is changing. And that is why majority of the people that are doing Jack syndrome, they are going there because a country, developed country, they plan for their elderly one, and you end up being a professional caregiver when you japa you to care your father and mother here so that they can live healthy and not die in pain. Thank you very much, Anoa.
Thank you, sir. So, in addition, I would like to say that we also have geriatric physiotherapists. So, if you're talking about the elderly, you can come and register and become a geriatric physiotherapist. This is and money and fashion, everything. So just like undergrad, you go for undergrad physiotherapy. Much time. Sorry. Okay, this person is so that they can make for entirely.
Thank you so much. Congratulations and question.
Okay.
But I'm now already. So you know, exploring the epidemic, social epidemics among adults. Obviously, we didn't know, I didn't have information. When actually would be found adults and then explain the difference between the hard region, the difference shared light between symptoms of leukemia and how those interact.
Who's gonna answer that?
Okay. Thank you very much. I want to appreciate the person that asked me question that he actually listened wonderfully. Now, the reason why we call it silent killer is that, or silent epidemic, as the case may be, is that majority of the time people actually suffer no injurious fall. And because it's not injurious, they will not report to their physician. And even the physician, they will not even ask. So, and what we do in our clinic, care of older person's clinic, is that there is something that they call comprehensive geriatric assessment, CGA. And part of the component there, so that component is, they call it functional domain. Under the functional domain, we ask you about routine self-care. Can you dress? Can you eat by yourself? Can you maintain your hygiene? Can you understand what I'm saying? Then why asking that functional ability? We now ask you, in the past 1 year, have you had a fall? So from that single question alone, because previous fall is a risk factor for subsequent falls. So we now ask, have you had a fall? Will that fall? Now every time or every month that they fall, that's what matters most. So we now say, okay, Mama, so that means you've been falling every month. Thank God that it was not injurious. You understand? It wasn't, you didn't sustain any, but we must help you to find out what is making you to fall before we now call it amusu or ajomadu. Before we call it winch or witchcraft, we must check, is there any intrinsic thing, internal personal factor that is making you to fall? Is it due to your home? And that is the reason why they call it what, a silent killer. In fact, look at this banner. 4 are the second lead cause of what? Unintentional injury death. What? Why? The serious injury. I show a slide that
by 2030, 49 million will sustain fall. And if they fall, the question is, if you fall, you have head injury. How much is the cost of doing exploratory bowel when people are not even eating? So that is number one. Then concerning frailty and sarcopenia. Now, frailty simply means increased vulnerability to loss of homeostasis. There's something they call homeostasis, which is made. But little triggers like stressor can make somebody to be what? To be frail. Now, sarcopenia is just loss of muscle mass and quality. My co-speaker show us the MRI imaging that have muscle strength and somebody that has lost muscle strength. Now, sarcopenia is a component of what? Of frailty. And when we are talking about the frailty phenotypes, we agree with me that we say extreme what? Muscle weakness. We say unintentional like what? Weight loss. We mention issue with slow gait speed. We mention issue with what? Low physical what? Activity. All of them are interwoven because frailty, what will make somebody to be frail could be as a result of infection, as a result of uncontrolled medical condition. It could be as a, and you know one thing about it is that when somebody is frail, the person has low level of physical activity. What will happen? It will the conditions, it will start losing strength, and the person will be weak. And that is why physiotherapy come to rescue. I like the last slide, and I like what you mentioned there. Strength and balance, coordination, and flexibility. These are the work that physiotherapy does. So the thing about it is that frailty, sarcopenia is a component of frailty in terms of what? Low muscle mass. And that is the question. So we want to prevent frailty. And how can we prevent frailty? Is to ensure that condition that will make somebody to be frail should be what? Should be well addressed. If the person has infection, address it. If the person has cancer, they can't blow cancer to anyone. We're talking about any infection. As simple as prostate cancer, with PSA, you can pick. It's so wondering that PSA is a test, is a blood test for this thing. I saw one on my head and he said, just do PSA for us. He said, he's feeling weak, he's feeling weak. We did the PSA show 1,002 instead of 0 to 4. 1,002. In fact, I took him there by myself because I don't want him to go to Babalawo. And before you know it, they quickly address it and the person can move. So inflammation, infection, malnutrition, you understand? This thing can make an elderly to be free. Thank you for that question.
Thank you so much, sir. I will give you a round of applause. It's okay. And no. Okay, one question. So the answer of question and please oh, okay. Attend our deputy HOD.
We agree with me, it has really been an exciting time. And we want to say a very big thank you to our presenters. First of all, my stepfather, my mother, one and only husband. Yes, I just realized now, I was even going to my mom, because I just realized I have a lot of things in stepfather. So thank you very much. We are very grateful. And my very able colleague, his son Morton, said, very big thank you. We are proud of him. So let's give our presenters a good round of applause. I think the standing ovation will not be too much. Thank you. God bless you.
Thank you very much, ma'am. So, Miss Follower, please come forward. I'm only giving you about 3 minutes, so let's make it start with you.
3 minutes to 5 minutes. Is this one?
Yeah.
I should use this one too again.
Okay.
Good afternoon, everybody. Am I audible? Is it audible? Okay. Good afternoon, everybody. Yes, my name is Fogofolua from Philips Pharmaceuticals, and we have been partnering with Lasso Physio for years now on one of our products, Fastum Gel, which I know everybody knows about Fastum Gel. I'm just here to just talk briefly about the benefits of Fastum Gel, just a reminder of Fastum Gel to your patients. And I hope you keep passing the benefit of Fastum Gel to your patient. So for Fastum Gel, it has a more benefits compared to oral NSAIDs. Fastum Gel is a ketoprofen gel. It's a cold gel, and it has easy administration in long-term use, especially for physio patients. Mainly when they come, they use it for a longer duration compared to other patients. And Fastum Gel, it requires no preservation of ingestion and less destructive than pills. That is, your patient do not have to worry about pills count. The patient tends to worry about pills counts better than gels. So Fastum Gel is a gel on its own, so they can use it for a number of duration they want to use it compared to pills. And according to ACP and American Academy of Family Physicians, it is recommended that all physicians should use gel as the first line therapy for acute pain like arthritis and other pain, generally pain. Fastum Gel should be used as the first line therapy to reduce or relieve symptoms, including pain. And for the global assessment, compared to other conventional gels, Fastum Gel has more improvement. It shows there's a chart for it when compared to other conventional gels. So Fastum Gel is more effective, better than all other gels, and it's also very good. No grease, no stain. So your patient can use it anytime, even if they want to leave the house. It doesn't have any stain or grease. And there's absence of fatty residue for Fastum Gel. So Fastum Gel is indicated for treatment of rheumatic or traumatic pain, like the osteoarticular and the contusions, the sprains, the muscle strains, torticollis, and lower back pain. That is what Fastum Gel is indicated for. And it can be massaged likely to the facilitate absorption of, it can be massaged to the affected area slightly to facilitate the absorption through skin. Fastum Gel comes in cold gel, it's not a hot gel. So it's cold gel and suitable very well for elderly patients. Most times, elderly patient comes and say, oh, they like sometimes very hot, it works faster. But to say Fastum Gel has proven, we have a lot of, what's it called? Comparison of other gels with Fastum Gel, and it shows better therapeutic effect than other gels. And fasting gel, if you don't want to massage too much for the patient to get the relief they want, you can slightly apply gently and you still get your result. It's very fast and has a very nice smell. Thank you. And I just want to like appreciate and keep pleading to please keep prescribing fasting gel for the patient. Thank you very much. Thank you, I'm done.
Okay, so far.
There's no need for.
All right, thank you so much. Do we have any questions for Pastor? One of the gels that we prescribe for pain relief. So if you have any questions for her before she goes, you can. Any questions? Okay.
Thank you.
I will appreciate that. So, on that, you can do one. Thank you.
Oh, that was a really nice one. Now, it's a challenge.
Okay, for now, we don't have samples. Since the beginning of this year, we've not had samples. So you can actually get the physio clinic now. No, not free. I didn't say not free, but we don't have any samples now.
Okay, I'll try to what you said. You can actually get in our department and it's very, very affordable compared to where you buy it outside.
Yes.
So, yeah,
Thank you.
you're welcome. So, how we start from Mrs. Ogofolola? Now, I'm hungry. Don't worry, I can tell you for me. All right, so we have another speaker. You could, in person of Mr.
That's where the long term for this particular patient. Their samples are being checked and we think that in terms of operation, we are trying to get a lot of patients to get used to local patch because it's not something that is in Nigeria. So we are looking for patients to get to get most of the your patients. Local patch will come in and for them. Thank you very much. I don't know if we have any questions. Yeah. Yeah, so we can. So I need the bigger one. Yeah. Because and that's a movable area, so we have to use the bigger one, not the smaller one. So it has there are 3 layers of cellophane is already. So we need to put the middle part so that the middle part is gone. We don't have to touch because that's what the active ingredient is. We don't have to touch the face of it. So there's a cellophane here and here. So all we need to do is to just they're both sides. What part now? Can you just touch? Okay, so
One thing about look at the pain. Anyway, just look at it. I'm thinking, I will throw it away.
okay, one more. That's how it works. Okay, that's good.
I will call my family.
Is the just to so but for the buffer one, you will see there are 2 patches attached to one. There are 2 patches, so you can use one to go. Then the second one can be kept safe. You have to. What part will? Okay, so let's go this way. So the other one will still be intact, and you can use that one after 8 hours. One patch will last for 8 hours. So you can leave it there for the next 8 hours. You're welcome. Yeah.
Yeah, but I use a Diplo, I can't remember the name.
Is it oily right now?
No, it's not like Diplo.
Yeah, it's fine.
That other one that's like
Oh yeah, you can still use this. How long did you use that?
don't use it for 2 days now.
Oh no, it's fine. You can use this. So this will stay on it. It stays on the affected area for 8 hours. Then after 8 hours, you can take it off, then use another one until you don't feel the pain. Am I on the right spot? I'll just go down one. Feel some sort of heat sensation, I'm sure, right now.
So carry sweat. Someone is going to talk. Who is that? Okay, so Miss Joko, can you tell us how you are feeling now? Tell us, express yourself.
Seriously, good afternoon, everyone. I'm the head of admin and physiotherapy. I'm really feeling relieved, very, very relieved. Even the sensation, yeah. So that's what I really want to talk about. Sensation, is it earth, people? See without
Okay.
Thanks, ladies and gentlemen. My personal is the indication, yeah, it's not you can even go Tuesday. But under the second of so how do you use it for Tuesday? It's my own skill. It's not very supposed to put it directly on your teeth. We don't advise that. It's actually for other surfaces, your back, your shoulder. Yes, external applications only.
I have a question.
Except when I say external, I'm not putting it internally, yes.
Huh?
Yes, you can penetrate.
Now, and then the effect is, yes. Question. Okay. How do you pass the mic to her? I'm sharing forever.
No, there's more, there's a lot. Examples.
your chances of being able to self-surprise was how effective is this patch? And also mention how effective is this patch?
The mic, and I. So, some select something mild to moderate. As an admin therapy, so medications or maybe there is a localized pain, you can use the patch at that point in time. So better with the oral drug. That way you don't have consistently repeating if you are putting an answer, you have to keep repeating the end. Then for insurance, usually when indication for that, we have patients that baby and the person results from that. We have an indication for it.
All right, thank you so much. Do you have any other question? Okay, thank you so much for coming. Now,
Thank you. Sorry.
It's okay. Hold on.
I'm zooming out. Make I show you this time.
Hello. Thank you. Thank you very much.
Good afternoon, everybody. I'm very happy to be in your midst this afternoon, so I will just go straight to the point. So my name is like this. It's better. My name is Munirat, and I work with Pocari Sweat. So if you're wondering what Pocari Sweat is, Pocari Sweat. Are you okay here? So come back. Okay. Okay, so Pocari Sweat is an iron sulfide drink. That's an electrolyte drink. What it does is to replenish the body with blood, fluid, and electrolytes. So our company is a Japanese cell phone company, and we are divided into two businesses. So we have the pharmaceutical and nutraceutical business. So in the pharmaceutical business, IV solutions. Oh, how do I say I should move to that side? Should I go there?
Just move a little.
Is it okay? Okay. So for the nutraceutical, we make products that have nutritional value and also have pharmaceutical value. So the idea of Pocari Sweat was better from IV solutions. So the purpose of making something that is drinkable and healthy, so that everyone is dehydrated, having diarrhea, losing body fluid, and they need to recover back, they will just easily open this and take it. Pocari Sweat is an electrolyte drink that replenishes the lost body fluid and electrolytes. People are having diarrhea, you're dehydrated after workout. This is actually very healthy. So once you open it, you have to finish it within 24 hours because it has no makeup preservative. Exactly. So anybody can take it. A child, in as much as a child can eat and is having diarrhea, they can take it. People that go to the gym, you can take it. In the hospital recovery, pre-hospital recovery, they can actually take Pocari Sweat. It's not carbonated. There is no caffeine in it. So if you have any question, you can ask me. Thank you. Any question? No question. Yes, there's sample. They will give everybody a sample. Any other question? Thank you very much. Enjoy the rest of the program.
Wow, where is the sample?
One more thing. I've given them already.
College náà fẹ́ jẹ́ fún mi nìyẹn.
For you, Pocari. Okay. Well, don't worry, they'll share it. Share the samples. We have enough samples.
Minute back.
Alanda.
So we are going to begin today's presentation. Can you give the physiotherapy program?
Yes.
Giving one to you. Okay, thank you so much. I'm going to call on Ms. Therapy to come and give us a closing remark. What now? Thank you so much, ma'am.
Good afternoon, everybody. Good afternoon, everybody. We thank you all for coming. We pray that God Almighty will grant you journeying back to your respective destinations. We give glory to God Almighty for preserving us, for having this World Physio Day 2025. And we hope that next year will be bigger, better, fun, exciting, and a very beautiful team, just like we've had this year. Thank you all for coming. Thank you very much. So God bless you all. Bye.
Thank you so much, Nayoka. So before we go, I would like to say thank you and give honor to whom honor is due, to our sponsor, Mr. Junai. Let's keep giving them a sounding round of applause. Mr. Junai, please
Pharmaceutical Nigeria Limited, makers of practical. Islamic pharmaceutical makers of Sarantan, Embassy Pharmaceutical Nigeria Limited, makers of rubber oil, Sanofi. Also Pharmaceutical Nigeria Limited, makers of the and finally, PPL. So we really appreciate the organization for supporting and sponsoring our program today, and really hope to see them and partner with them next time. Okay, so lastly, we are going to say a very thank you to our seniors, our patients, the friends of our department. For giving their support very much. Now we together in 1 year. Keep clapping for them. Now moving up, keep clapping, and now moving up. You also not clapping. I want to say thank you so much. We really appreciate. We proud and we can stand on. We are really, really thankful. We appreciate you. Love you all. To all our patients. We love you. We appreciate you all. Thank you so much for coming to grace our occasion. Thank you so much. Thank you. And now to our own. If not for us to live in here, having physiotherapy without mentioning our organization. If let's give a resounding round of applause for that. Thank you, everybody. Thank you for coming. Really, I'll see you guys next year. I love you.